the happiest place in the world, where you get everything done right and never do you see a flaw or a mistake that is thought of, and you get exactly what you want. A hospital is now getting compared to the service levels of Disney. A hospital service is getting compared to the service levels of Ritz-Carlton. So we've just heard about hospital not being a place you want to go. Yes, nobody goes to a hospital by choice, but when that happens, can that be dealt with in a manner so that that sickness and illness is minimized? And for us in this part of the world, where Ayush is a well-known form of medical practice, dealing with the mind as part of it is very, very essential. But when you want to deal with all of this, you have a problem of manpower. That's exactly where technology comes in. You have a shortfall of manpower, you have a shortfall of skilled labor, and you have a rising demand. And a rising demand on a profession and a service delivery that is not a statistic. None of us want to hear the doctor tell us that 99% of the cases my surgery will be successful. God, I don't want to be that 1%. You're not looking at that aspect of it. Healthcare delivery is not a statistic. So there is nothing less than perfection that needs to be delivered. When you're looking at that perfection being delivered, you have to necessarily take the help of technology. The right mix of technology, delivering the right level of care at the right time, getting that information to the right set of people will give us absolutely fabulous outcomes, clinical outcomes that are absolutely delightful. And that brings together a complete team of people who can work, who are experts, who need not necessarily be there when care has to be delivered. So you're looking at technology being an enabler, technology not driving healthcare. That enablement is the right mix of delivering service. Take an example here. I used to work in Michigan, in Detroit, a few years back. The entire Detroit health system, the Detroit Medical Center health system, which is the most well-known brand in downtown Detroit, completely transformed itself to deliver emergency care. And in Michigan, where the education levels of that part of the society is not very high, the amount of people who go into the emergency system is very, very, very high. And when you're going into emergency, you are in absolute need of health care. Nobody goes into emergency because they thought it's a good place to walk into. A complete reorganization using lean principles, using Six Sigma was done. And Detroit Medical Center today, and if you go to the website, dmc.org, go to the website, you will be able to see the wait time that any patient will have to see an emergency physician. See an emergency physician, not get inside, do the registration, go to the billing desk, pay the paper, somebody will come. No, I'm not dragging here. To see an emergency physician, because when you want to go to a healthcare facility, you want to see the doctor. You don't want to go through the administrative part of it. Look at how an organization transformed. So if you're looking at changing yourselves, if organizations are looking at embracing technology, the need of the hour for organizations is to ensure that they take a deep look at themselves, a deep look at their processes, a deep look at what is the information you're collecting to deliver what service, at what point in time, and check if that entire supply chain is falling in order to meet the expectations of the customer. Here the customer is not necessarily the patient, it's also the family members. We've all experienced it. If somebody is sick in our family, it's the entire family who's worried about it. You're asking questions, you want to know more. So you're actually providing care to that entire care team, which includes the patient. How do you use technology to enable that? And that is where you look at remote medicine. That is where you look at telehealth. That is where you look at using such easier options that we have today for remote connection to disseminate that information. Chennai did a fabulous job when the dengue was prevalent. The social media was flooded with information on how to prevent. So you're also using technology to prevent. You're using technology to disseminate the right level of information. The right level of information that will actually get healthcare delivered better. Healthcare will get delivered to the right person at the right time if we all know what we need to know. So you're using technology not just for direct healthcare, but the entire support ecosystem. And that is actually why the patient is impatient, because there is an expectation. That expectation has to get managed through an effective delivery mechanism. So it's basically a call to look at organizations, to look at every part of the supply chain to find out what is it that we can do better to manage this. And when we look at that option, considering realities of workforce, realities of the economic strata of this industry, healthcare, that is not necessarily the highest paying job in the industry. Looking at all of that, you are going to get the right set of technologies to enable this care. Enable this care, because I've been asked this question several times. Are you guys in IT going to take over the doctor's job? So are we not going to have doctors, and are we going to have all these gadgets and robots flying around? I don't know how to answer that question, but in Tamil they do say one thing, alavukku meerinal amridamum nanju. The more you even God's sweet potion is poison after it crosses a certain level. That's what it basically means. So you're looking at what is it that you can do to enable that technology. So calling the patient impatient is probably doing injustice to our system. I'm not trying to tell Raju that we have to coin the whole session in a different manner. Too late to make that suggestion. But the expectation has to be acknowledged. Processes have to be relooked at. It is not merely applying technology. So let's take an example here. I got a Fitbit. I'm going to wear the Fitbit. And do you think my paunch is going to become smaller? 7 men can take this horse to the water. We have to do what it takes to actually get the benefit out of applying the technology. Merely the thought of having technology is not good enough. Merely the thought of investment in technology is not good enough. It is the application of the technology at the right use case. You can't overdo something. You can't crack a nut with a sledgehammer. Should not attempt to do it. Yes, the nut does get crushed, not cracked. And that is actually, when you crush a nut with a sledgehammer, you're not getting the benefit of what you wanted to do. Applying technology in the wrong proportions will do a great injustice and a complete deviation of what is the expectation of the patient and the society from the health delivery system. Thank you for being a patient audience.
I request Dr. Poorna to come to the dais, please.
So, good afternoon, all. Nice to meet you after the lunch. I thank the MMA and I thank the other organizers for giving me this opportunity. Actually, my managing director is supposed to speak in this topic actually, but he was not well. I'm representing him actually. See, the healthcare industry is developed on goodwill. It's never developed on money, and it is never for money. It is developed for goodwill, and the goodwill is the earning we get in the healthcare industry. So, if we go through the healthcare before internet era, so we had a concept called family physician. From our childhood, we'll be seeing only one physician, okay, and he will be guiding us to the other specialties if when needed, and we will go back to that physician, and we trust whatever he says. Because at that time, knowledge is not available in internet or any books or anything anywhere. So they have to get the knowledge from that family physician only. They believed him, and in many places, doctors are gods. But evolution is life. If you take, we all came from a single cell, okay, that evolved and came. Like that, every industry, every system evolves, and we have to adapt to the system. Okay, the change in dynamics between the patient relationship with the doctors is what we are talking now, patient. So what happened to the in the era after the internet thing? The patient has symptoms. He just Googles up the symptoms. He finds some 80, 90 diagnoses. He confuses himself. And then he just thinks I should meet this specialist. He just goes online and reviews his ratings, which hospital I have to choose, which doctor I have to choose, and then he comes. So we have a mix of, it's not like a pre-internet era where the patients are not informed patient at all. We have an informed patient who knows what disease is, but we have a patient who is confused with so many information from the internet. So we call this person as informed. So trust is the main relationship previous to internet era. Now it is informed trust. They want a physician whose knowledge matches with the information in the internet. So if you take the patient and physician relationship, the basic is trust. Okay, in information era, the trust is replaced by skepticism and weariness. Physician believe an informed patient is a threat. So naturally, last week, my gynecologist was telling, this patient was asking me too many questions. He was not talking about the relevant disease. He was talking about all the complications. His wife is just pregnant. He is worried about whether she will get eclampsia, whether she will get antepartum hemorrhage. And is wasting his time and wasting my time also. The physicians feel that this way patients in this impatient patients are the problematic patients, and they feel the human touch is lost in decision making. So the trust is lost. But I told my gynecologist that there are a lot of positive and adverse effects in this information age. We have to accept the changes, and we have to go through this, and we have to accept this evolution also. See, patients who use the internet to look for health information are more likely to be more specific and informed questions to the doctors and comply with prescribed treatment plans. You just tell them, you Google up this site, you see this information page, you will get the information. You can think about it, come back to me, discuss with me, then I'll explain to you. That gives a positive effect. And the second point, if I'm doing a complex procedure, I'm going to use a laparoscopy, I'm going to use a colposcopy, I'm going to use a robotic surgery. How different it is from the conventional surgery, I have to explain him actually. And previously I have to take a paper and put on do diagrams, they will not understand the diagrams. But with the animations which is available in the YouTube, it is very easy for me to educate the patients. And they also understand, they see other websites, and they come back with a clear knowledge. So this is the basic. The internet age offers opportunities to improve the patient-physician relationship by sharing the burden of responsibility of knowledge. Patients still trust physicians, but the only thing is they want to match with the information available in the internet. Though they have many things available in the internet, finally they come to the physician only. So what the physician has to do now is he has to take the responsibility now. He should be a consultant helping the patient to sort the information available on the internet and arrive at informed and intelligent decisions. So the other aspect I want to touch is the chronic diseases, or the diseases which has only control, which doesn't have a solution. For example, asthma, oncology, and with the people living with SLE, autism, and diabetes. Okay, these online support groups give a lot of positive effects. So the support forums, they discuss a lot of things. They conduct a meeting, whether it's online or offline. They feel relieved when they see the others and get a lot of information from that. So now I'll tell about the negative adverse effect of the thing. We have a confused and worried patient, and they see not only one physician, they go to many physicians to confirm the diagnosis. When the first physician is giving the diagnosis, they are not accepting it. They are going to the other person. When finally all the three physicians are talking in the same line, they accept. If they are not talking in the same line, they become confused and they are lost. Sometimes they influence the patient with the prefixed ideas. So sometime back I met one patient attender in the ICU. He simply had a pneumonia, actually. He was admitted for a pneumonia, and he was coming out of the ventilator. He was doing well, actually. And his daughter is worried. Doctor, is this not the ARDS? Because she came to know that ARDS is a dangerous disease. I said, this is not ARDS. Then she asked me whatever the information she got from the internet, is this due to this? These symptoms are there with my father. Can you explain me the X-ray? Why can't you do a CT chest? All these things they are asking. So sometimes they are interfering in decision making and they don't accept treatment also. And the worst thing is, this is the main reason for the malpractice cases now we face, which is the consumer related cases are increasing day by day because of this misunderstanding. And this is a situation now the physicians are facing now. So how to overcome it? So we have to accept the online information, and the doctors also have to see what other online information is providing, and then they should mix these things with the patient and politely warn them about the reliability and variability of the information available in the online, and never think informed patient is a threat, actually. So we can actually make advantage of this technology. So we can provide a lot of information online that saves doctor's time, that saves hospital visit time, and we have remote monitoring. Maybe we might have lost human touch, but digital touch is gained. Okay, there are now, for example, if you take, there are apps, okay, there are systems which can monitor the blood sugar continuously and can feed the doctors, which is very helpful for them. So time saving is the main factor in the healthcare industry. So why the patients are impatient? Because I don't want to stand in the registration queue. They don't want to give the history to my physician assistant. They don't want to fill up consent form. They don't want to wait to fix the appointment or rescheduling. Okay, when all this can be done in online, I save a lot of time. I also save a lot of time. My patient also saves a lot of time. And not only that, even when I'm prescribing a drug, I might go wrong. Okay, that is saved when I do an online prescription. Okay, because the data is prefixed, the dosage is prefixed, and what the instruction they have to follow is prefixed. I have to just verify it and give it to them. And maintaining the medical records electronically. Okay, because when I joined my medical college, I was wondering why the doctor's handwriting are like this, actually. So when I was doing my post-graduation in Tanjavur Medical College, I used to see in my pre-assessment clinic every day 100 patients. Ultimately, my handwriting also became like that. So then I understood why all the doctors are writing there. Then it became a habit actually. So with this, this electronic records, all these things are overcome, and it provides a very good platform for patient education. So we can advance our technology. Now there is a electronic ICU where the physician is sitting on place, and they are managing a patient in ICU in Srivilliputturu, Rajapalayam, all these areas, where a skilled paramedic is attending the patient, and a knowledge person is giving them what has to be done. And we can use this technology to avoid the malpractices also. Okay, when you explain the patient electronically, you just show them a video and get a video consent. Okay, all these malpractice things can be avoided. So nobody will deny that I didn't understand what is written in my consent form. I didn't understand what is anesthetic risk. I didn't understand what is a complication. It's okay. And lot of innovations are yet to come in the healthcare industry. Okay. Now, as he was telling, as he was telling earlier, so now the healthcare industry is shifting from doctor-based to a team-based service. They are expecting a good hospitality, good service, and correct clinical decision, and reach at home. Okay. So use the technology to improve the quality of life in physical, not only physical development, any diseases actually. And our country needs to build a high-tech healthcare centers, both for affordable and non-affordable patients. And this digitalization will help a lot in this aspect. And slowly these inpatient patients will become a real patients. That's what I believe actually. Thank you for giving me this opportunity.
Thank you, Dr. Poona. There's a question for Om from the audience, and there is one more. We have time for 2-3 questions, then we have to wrap up. Yeah, go ahead.
Okay, the question is from Mr. Hari Kumar Medal. The question is, how do you deal with a doctor who refuses to believe your reports? And the second part of the question is, what kind of digital intervention do you propose in such situations? So I think the question is valid. There are many times when because doctor is seeing the patient and the clinical symptoms have to correlate with the report, it's quite possible that doctors may come back to us saying that somehow this stuff is not matching. I think in a situation like this, we have a protocol where we keep the sample for almost a week. So in such situation, you repeat the test and see if there is a variation in the results, and you interact with the doctor accordingly. Digital intervention in such cases that you really need to connect technical people on both sides. We have a customer care which generally is sometimes not that technical, but in situations like this, our technical customer care comes in play and they have interaction with the doctors. So that's how we deal with it. I guess with more and more technology coming in, maybe there will be an app also for the doctors as well as for our head of departments where they can interact through app as well. So that's my answer.
There's a question from Vinayak Bhatt. How is the technology and digitization helping medical professionals to protect themselves from medico-legal cases? We do get those. I think today there is evidence digitally stored. One of the biggest one that most patients sign is what we call as a consent form. And having that consent form helps a lot, because sometimes the treatment by the doctor is not, you can be that 1% or 0.1%, and they do happen. But the other time, if the results are wrong, you have to accept it. And if it was, a clear mistake of a doctor or a technician, we end up compensating in those cases. But now with the digitization, it is now very clear, what was the result. The results are stored, samples are stored like he talked about, and scanned reports are stored. So I think it's important that digitization comes in more to protect both the consumer and also help the doctors. And I really hope medico legal cases don't go up, because that cost will add almost a 30 to 35% cost, which is what the countries like America are now paying for the medico legal insurance, because somebody else is going to go get an insurance and pass it on as a cost to you. There is a question to Om. Western countries are focusing on outcome based healthcare service level rather than prescription based services. Where do we think India is going? From Medtronics, Mr. Senthil. You can also answer this.
I guess my colleagues from hospital space would be able to answer this better. Why don't you try?
Just read the question again. Countries are focusing on outcome-based healthcare services rather than prescription-based. Actually, answer to this is, if I can couple Raju's comment with the question that was asked. Looking at digitization is actually going to help medico-legal cases as well as drive outcomes, because what you're getting to with digital, with electronic assisted healthcare, is evidence-based medicines that are guided by pathways and protocols. So it is coupling quality, evidence-based medicines, a structured way of diagnosis and providing care and interpretation of the care. So it is not necessarily going towards prescription-based medicine, but it is outcome-based, going on structured evidence-based medicine. So electronic, digital, whatever we want to call it, is kind of driving us towards that. And India is also going towards such like evidence-based care, not necessarily incident-based or encounter-based prescriptive medicine. So that's, I hope I helped answer that. Okay. This is a question from TCS. So the first comment is, though the gentleman is from TCS, I believe he's got a doctor's handwriting. The consultation in India still the conservative way. The patient had to travel to meet the doctor. When will we be digitally connected? Yes, there is a mindset. Today we find it more comfortable, or I shouldn't say comfortable, we find it mentally comfortable to go and meet the doctor. Again, in vernacular, doctor nalla tottu patara. Did the doctor touch and feel you? So, yes, it is a mindset. Options to go digital are available. Acceptance is low. The fear that you may not get the best care when you are not in direct contact with the healthcare provider is what drives that mentality. We will have to change and we'll have to adapt ourselves. So this is a transition from cash to the ATM card. So that's really what is going to drive us towards remote medicine being provided. That's pretty much what it is.
I'm really happy that we got lots of questions, but I have been told that I need to wrap up because we are almost 3 minutes over the schedule. There are 3 questions, one from Rajiv of Emerge and Monica of Shasan and Shankar. These questions, can you guys take it offline? The speakers will be available. Either it is Dr. Purna or Arvind. You're most welcome to take it offline. Good questions, but in the interest of time, let me wrap up. First of all, the question is, why is this topic of impatient patient a discussion plenary session in MMA? And I really think that healthcare was not thought of as a business. Healthcare has become a business today. And there is need for management. Hopefully, we talked about the changes that are happening in the expectation from the consumer, the change in their behavior that we see, the technology that is coming in from multiple, engineering faculties, if you will, and the hospitality and the kind of comparison that was made to Disney. All of these, what does that mean? The expectations are growing, spend will grow, awareness is increasing, digital awareness is increasing, wearables are coming, people are understanding their health. And hence, there is a huge opportunity for those youngsters from many of those MBA students sitting in the back and the others to find a way to come into healthcare, because I really believe that there is an opportunity for all of you to come in and be part of this growth that is going to happen. Healthcare is going to be the sunrise sector for the next 5 to 10 years as the awareness grows. Complex human body, let's not oversimplify it. Let's not find a solution in Google. Let us understand that we continue to trust. Maybe we can trust and verify, but trust is important in this, and don't lose it to some kind of information that is available. So it's important that we give that message and try not to become too impatient also, because there is a depth of process, the machines, the technology, the human analysis that goes behind in diagnosing what you have is not easy, and it should not be oversimplified. Can artificial intelligence, machine learning take them over one day? Probable, but the input variation that we have as a system is so high that it may take a long period of time to come up with solutions which are completely going to eliminate the medical profession. And my last message to all of you is stay aware, stay healthy, and enjoy every minute of your life. Thank you. Bye.
Thank you, sir. May I request the chairman of this session to kindly present a mementos to the distinguished speakers. Can we have a round of applause, ladies and gentlemen? I request Ms. Kavita Chitturi, the President of Madras Management Association, to kindly present a memento to the chairman of the session, Mr. Raju Venkatraman. Thank you, sir. Ladies and gentlemen, we come to the final plenary session 4, plucking the right strings, leading through music. Yet another interesting, a very different topic. As mentioned to you, MMA Chennai is the Facebook page. Stay connected with the page and network with the members who are part of the Facebook page. And we are also very proud to share with you that all the major events of MMA are webcast live for the benefit of the large members who are outside Chennai city in our chapters. In case you missed the webcast, you could watch the recordings which are loaded in the website of MMA, which is mmacennai.org. Ladies and gentlemen, please welcome Ustad Amjad Ali Khan, the Sarod Maestro, Subbalakshmi Khan, Bharatnatyam exponent,